Hi, this is Dr. Walker from Denwalker.com. Welcome back to the channel. Today I'm going to talk a little about a saltwater Soleil. And really, it's about keeping your hydration. So I know a lot of folks, they're drinking a half gallon of water, sometimes a whole gallon of water they're drinking every day, which is great. Keep your body flushed and your kidneys hydrated and so forth. So it's a wonderful thing you're doing all that. But the problem sometimes you can have with this is that you could run the risk of diminishing the concentration of your electrolytes in your system, specifically sodium, for example. So if you drop your sodium levels too low, called hyponatremia, you run the risk of a lot of bad things: confusion, muscle aches and pain, fatigue, poor mentation, confusion, lethargy even, right? Dizziness, lightheadedness, all of those things you run the risk of when you become hyponatremic. So, and that happens typically with people who drink lots and lots of water. And some people actually tell me that they're working out really hard, and they're drinking all this water, which is great, but they feel a little lightheaded when they're on the treadmill or when they're running, whatever else. You don't want to be running and, passing out and bumping your head and all that sort of stuff. And so what I talk about today is just that, how to decrease your risk of having some problem while you're working out and drinking too much water. So it's called a saltwater Soleil. And really what it is just adding back some minerals to the water, because you're drinking water by itself. There's no minerals for the most part not much in any sort of water that you're drinking. So doing this way is going to help you add back some minerals to your water and hopefully reduce your risk of having some complications from that. So it's called a saltwater Soleil. And I do not recommend using table salt for this. And I talked about before that table salt has chemicals in it that breaks the caking agent, they're calling them, that breaks down into cyanide. And there's so many things that we take for granted that has cyanide. For example, your B12, for example. Look at your B12 container and look to see if it says cyanocobalamin. It's sort of the same thing. It breaks down into cyanide. So salt does the same thing. And it'll tell you that it's not consequential. So in other words, it's immaterial, right? But if you're taking so many things with cyanide in it, I do not believe that. So I suggest that you do not use table salt for what I'm about to tell you. You can use either pink Himalayan salt, organic version, or Celtic salt. Either one of those two things work just fine. So you can get yourself a mason jar, maybe 16 ounces bottle, and fill it with water. Then take 2 or 3 tablespoons of pink Himalayan salt, heaping tablespoon, and add it to your water. Again, Celtic salt, sort of the same thing. Heaping tablespoons, add it to your water. What you'll then do is mix it around for a couple of minutes, and then you leave it for an hour or two, and come back to look at the bottle. If there is no salt at the bottom of the bottle, then the concentration is not what you need. Add more salt, another tablespoon or 2, and do the same process all over again. So bottom line is, when you come back in an hour or two and look at your bottle, there should be some salt at the bottom of the container. Okay, once you have that and it's done, take 2 tablespoons of that combination and add it to a gallon of water. Mix that around. What you then do is drink your water from that bottle, that gallon bottle that you now have the salt added to. Do not drink the one that has, that you add a tablespoon of Himalayan salt. Don't drink that one. That one can cause some problem like diarrhea and so forth. So don't do that. Add the 2 tablespoons of the salt water to your gallon of water, 2 tablespoons, and drink from that water. So then, pink Himalayan salt and Celtic salt have somewhere between 80 and 85 thereabouts minerals in those things. So all you're trying to do is get back some of those minerals in your drinking of your water throughout the day. So you should not then have a problem with lightheadedness and dizziness and fatigue and confusion because you're drinking too much water and decreasing the concentration of your electrolytes in your system. Anyway, hope that helps. Thanks for listening. Dr. Walker, take care.